The liver is the largest internal organ in our bodies, and also the biggest gland. It has several vital functions. First is bile production, the greenish-yellow fluid produced by the liver. Bile plays an indispensable role in digesting and absorbing fats within our small intestines. Second, liver has metabolic function. For example, after eating, our blood glucose goes up. This is where the liver comes in. It converts this extra glucose into a storage form called glycogen. It's like the liver's way of balancing out our sugar levels and saving some for later. Conversely, when we haven't eaten for a while, the liver now converts stored glycogen into glucose, so our bodies can use it as fuel. Moreover, if there is any excess carbohydrates and proteins we consume, the liver changes them into fatty components, and fat tissue increases. That's why we gain weight. So, when we say metabolism, we usually mean convert one substance or components to another. Liver also creates proteins, detoxify different substances. For example, when we drink alcohol, liver converts it several times, until we get water and carbon dioxide from alcohol. So liver neutralize it because alcohol is toxin for our body. Liver also detoxifies drugs and converts them non-toxic components. Now, what are the 3 most common diseases of liver? Most prevalent liver disease is nonalcoholic liver disease. Due to increasing obesity rates, it's where too much fat is stored in the liver, affecting a staggering 25% of people globally. Following close behind are viral hepatitis and alcoholic liver disease, which is due to excessive alcohol intake. Now, let's discuss liver tests. The most common are the liver function tests, LFTs, which mostly look at liver enzymes. For instance, if ALT, alanine aminotransferase, levels are high, it's a sign of liver inflammation and tissue damage. Another enzyme, AST, does a similar job, but it's not just linked specifically to the liver. But combination with ALT, it also defines liver damage. Another enzyme called ALP or alkaline phosphatase. High levels of ALP can mean 2 things. There could be a blockage in the liver's bile ducts, or it might be linked to problems with the bones. Another test to know about is the bilirubin test. Bilirubin is a substance our body makes when it breaks down old red blood cells. High bilirubin levels can turn our skin and eyes yellow, a condition called jaundice. This yellowing can be because of a liver disease or something blocking the bile ducts. Now, let's talk about albumin. The liver makes this protein, so checking its levels gives clues about the liver's health. Low albumin might mean the liver isn't working right, in cases like chronic liver disease or malnutrition. Another important test is the prothrombin time or PT. This checks how fast our blood clots. Why does this involve the liver? The liver makes substances that help our blood clot. If prothrombin time is longer than usual, it might mean the liver isn't making enough of these substances. It's also a sign of liver disease. Use imaging tests like ultrasound, CT scans, and MRIs to get a closer look at the liver. These pictures can show the liver's size, shape, and texture. They can also spot problems like tumors or cysts.